Norma Olvera, and I'm an associate professor at the University of Houston in the health program. And
What role has the Latino caucus played in your work professional development?
Okay, the role of the Latino caucus in my career has been very important. It has been a way to promote networking. I've been able to meet a lot of colleagues who have very similar interests in academia and also Latino issues and also in research.
How did you get to where you are today? And please tell us a little bit about your background and what inspired your career as a Latina in public health.
Okay. Well, the way that I started was actually was very interested in health issues. There is diabetes in my family. Well, my parents are diabetic, so I know that the health status of my family were very important. I wanted to learn more about it. I also was very interested in how parents influence children's behaviors in terms of eating and exercise. So my career started looking at obesity issues related to Latino families.
Were there any stumbling blocks along the way for you?
There are several stumbling blocks. When I graduated, I had one of my professors in my first year of graduate school telling me that I had 3 things against me. 1, I was Hispanic. 2, I was a woman. And 3, I had accent. So she thought that it would be very difficult for somebody like me to make it in a career in research. But I was very happy. Actually, it was a very good incentive for me to do very well. I was my first in my class to publish in a major journal. I published my thesis in child development, and I published also my dissertation. I had all my classmates. So in certain ways, I always knew that I had to work harder. I had to work and do better than anyone else, not only to prove this professor, but also to do it for my community, Hispanic community, that we can do as good as or better than anyone else.
So what advice would you give a Latino or Latina student interested in a career in public health, and what do you wish someone would have told you about early on in your career?
Very interesting question. I think one of the major challenges being in this career in public health is the ability to do academia, to do research, but also as a woman to be a mother. So I wish somebody had told me that I could do all of them and relax about it, and be relaxed about it. I think I would have taken it a little bit easier in my career. I don't regret my choices. But I think it's challenging, especially because you as a Hispanic also want to be a good mother and be in every place at the same time, and sometimes it's impossible. So I guess my advice would be for a young Latino in the area of public health is to be able to have a good support and not to be so hard on herself.
If in research, what are some of the soft skills that researchers need to advance in their careers?
I think it's very important that as a researchers, one of the soft skills will be to be able to collaborate, to learn also to negotiate everything in writing ahead of, what's the back? Okay, 1, 2, 3. Okay, so I think it would be very useful to be able to learn how to collaborate, but also to stipulate the kind of collaboration that you want ahead of time.
And last question, what is different about public health research careers compared to other kinds of research?
Okay, I think the main thing in public health, what I see it, especially working with Latino population, is very different from other groups. It's more challenging in terms of recruitment and also retention, some of the studies, and also establish trust with the population, because they have the idea that people just come and do and study and then leave. So it is, I would say that it's different from other areas in public health. Working with Latino population is definitely challenging, but it also can be very rewarding.